get ready to kickstart your journey to wellness with the ultimate guide in town. Welcome to Wellness Unleashed with Doc Stone. Join us as we journey through the realms of natural healing, where ancient wisdom meets modern science. Prepare to be inspired by stories of transformation and triumph. With Doc Stone as your guide, discover the power of holistic living and the joy of reclaiming your health. Prepare for a whirlwind adventure through the world of holistic wellness. From fitness freaks to spiritual gurus, we've got something for everyone. So grab your sneakers, your yoga mat, or just your sense of curiosity, and let's dive headfirst into a world of wellness wonders. Wellness Unleashed with Doc Stone. Your path to a vibrant life starts now. Well, welcome back to Wellness Unleashed. I'm your host, Jeremy Stone, and I'm so excited to welcome all of y'all back to the show. We got a great show for you today. This week, we're tackling a big term that gets thrown around a lot: integrative health. Is it just a fancy way of saying alternative medicine? Is it just about taking supplements? The short answer is no. It's a whole new way of seeing you, your body, and your path to wellness. So let's talk about the need for integration. Let's be honest, conventional Western medicine is amazing for acute issues, for those emergency issues, the heart attacks, the traumatic injuries. It is fabulous. It is life-saving. It is very important in those situations. If you're hit by a bus, you go to the ER, no question. We call that acute care. But what about the things that are slowly wearing us down? The chronic fatigue, the anxiety, the recurring digestive issues. That's where conventional medicine often hands you a prescription to manage a symptom, but rarely digs deep for the root cause. This creates a huge gap, a gap where people feel unheard, frustrated, and incomplete. This is the gap that integrative health steps into. So we want to define and give you some of the core principles of what integrative health is. At its core, integrative health is healing-oriented medicine that considers the whole person. That means your mind, your body, your spirit, and your lifestyle. It doesn't reject conventional medicine. It blends it with evidence-based complementary therapies in a coordinated way. So it's not haphazard. It's not shooting from the hip. It's coordinating care using all of the different science-based modalities that there are available to us. Here are the three non-negotiable principles of integrative health. One is patient-practitioner partnership. I oftentimes tell my clients that when you go to see your doctor, your primary healthcare provider, I want you to think or to believe that there are two experts in that patient room. There's you and the doctor. You are the more qualified, the best expert at your body and what's happening inside of it. So with a patient practitioner partnership, you are an active participant, not a passive recipient. It's a team effort. You work with your provider to improve your health. Two, focus on the whole person, not just the disease. Too many conventional medicine doctors look at their patients and all they see is their disease or their symptoms. They don't see the entire person. So we want you to focus on the whole person, not just the disease, but all the factors, like from your stress levels to your diet to your environment that influence your health. All of those things play a major role in your health. And if your provider is not discussing those with you, they're going to miss the causes of your symptoms. And then number 3, the use of appropriate therapies. We use the best tool for the job. That might be a life-saving drug, or it might be acupuncture, or a dietary shift, or some type of supplement or herb, but it's always evidence informed. And now we want to share with you from one of our sponsors. I want to talk about one of our sponsors here real quick. And then when we come back, we're going to break down the key differences between complementary, alternative, and integrative. The names do matter. So we'll get into that right after we share about one of our sponsors. So today's show, one of our sponsors is Stubborn Bean Coffee. I love this brand. It was created for the slightly rebellious, the entrepreneurial, the big thinker, the person that is trying to change the world. And I love this coffee. It is all specialty grade coffee, which is the highest level of coffee that there is. Plenty of single origin, and I love the fact that they roast it to order. One of my favorite coffees that they have, though I've tried quite a few, is their Builder's Brew. Builder's Brew is actually a coffee from Honduras, medium roast, and it has mushrooms, cordyceps, reishi, and lion's mane, which we know in this world has a whole lot of benefits to your health and wellness, helping you to see clarity, ease some of that mind fog. This is about mind fog. This is the Builder's Brew from Stubborn Bean Coffee. You can find their coffees at stubbornbeancoffee.com. That's stubbornbeancoffee.com. Go on over, check out our sponsors there at Stubborn Bean Coffee. It's excellent. They're fun, and it is just a great, excellent, high quality coffee. So let's get back into the distinctions between, the different types, complementary, alternative, and integrative. And so we want you to make sure that you are very, very understanding, and we're going to look at it through the functional lens. So the terminology, let's clear up the confusion around the terms. Alternative means in place of conventional medicine. For example, using only herbal medicine to treat a serious infection instead of antibiotics. Is generally not advised. Alternative medicine is generally not advised for serious acute conditions. If you're having a heart attack, please go to the hospital, go to the ER. Don't seek out your alternative medicine practitioner. You need to see a doctor and get that taken care of. If you're in a car crash, don't go running to your alternative practitioner until you get stabilized and taken care of by your conventional medicine practitioner. Again, any type of medical emergency, please make sure that you dial 911. Seek out help immediately. And then there's complementary. It's used together with conventional medicine. For example, using acupuncture to manage your chemotherapy-induced nausea. So that's complementary. It complements your conventional medicine. And then there's what we call integrative, the coordinated and evidence-informed blending of both approaches by a coordinated care team. This is the sweet spot. So for instance, you may have a conventional medical doctor taking care of you, and then you also get assistance from an integrative or a functional medicine practitioner in order to help to support your overall healing. So we want to introduce the functional medicine framework. This is the area, the framework that our practice operates in is in functional medicine. And basically what functional medicine does is the huge part of this integrative approach, especially for chronic issues, is the functional medicine part. And think of it this way. Conventional medicine asks conventional medicine asks what drug treats this diagnosis, while functional medicine asks, why did the person get this condition in the first place. We look for root causes of your symptoms. So again, conventional medicine, they look at what they can do to treat a disease, or what pill, what prescription, what drug treats this diagnosis, what surgery will make it better. Whereas functional medicine asks, why did this person get this condition in the first place? So then they can treat that to prevent it from coming. So functional medicine providers look upstream. They use sophisticated testing to check on how your body's systems are functioning, your hormones, your detoxification pathways, your nutrient status. Example, a patient comes in with migraines. The conventional approach is prescribe medication to stop the headache, get rid of the pain. Whereas an integrative and functional approach investigates the triggers. Is it food sensitivities? Is it hormone imbalance? Is it gut inflammation, chronic neck tension? And then treat the underlying cause. I hope you can see the difference there between treating the symptom and treating the cause. If you only treat the symptom, as conventional medicine does, you're doomed to have the situation come back again. Whereas if we can identify and then treat the cause, you can eradicate or minimize the likelihood that you're going to experience that headache again. So let's talk about the mind-body connection. You cannot talk about integrative health without acknowledging the mind-body connection. Stress doesn't just make you feel bad. It changes your blood chemistry, it suppresses your immune system, and it affects your digestion. This is why integrative care includes modalities like yoga, meditation, biofeedback, guided imagery, hypnosis, because they are tangible physiological tools for healing. So I want to share about one of our other sponsors of today's episode real quick. And when we come back, we're going to talk about begin to integrate these principles into your life today. So another sponsor of today's show is Doc Stone's Natural Medicine and Wellness. It is a functional approach, those functional medicine labs to help you get to the root cause of your conditions, your symptoms, your diseases, your chronic health issues. You can get 10% off. Our audience gets 10% off functional medicine lab testing at docstone.wellproz.com. That's docstone.wellproz.com. And at checkout, use the coupon code Wellness Unleashed to get your 10% discount on your functional root cause labs. All righty, let's get back into the content for today's show. Talk about tools of the trade and real world examples of integrative approach to health. What does this blend of care actually look like? The integrative toolkit is vast, but here are some of the evidence-supported modalities you might encounter used alongside your medical doctor's care. Again, we're not telling you to replace your medical doctor at all. We want you to make sure that you're well taken care of, but we want to give you some other tools to help you to improve the likelihood of overcoming any kind of chronic illness. All right. So one tool that we have, or two tools, are acupuncture and traditional Chinese medicine. These are excellent for pain, nausea, and stress. There's also clinical nutrition or dietary therapy. Food as medicine is very, very important, using specific dietary changes to resolve inflammation, autoimmune flares, or digestive issues. And then we use, especially a lot in our practice, targeted supplementation using high quality vitamins, minerals, and botanicals or herbs to correct deficiencies and to support your organ function. As mentioned, you cannot avoid talking about your mind-body connection. So these practices like meditation, Tai Chi, or even therapeutic massage for chronic pain and anxiety. And then lifestyle coaching focuses on the 3 pillars of health: movement, sleep, and relationships. Very, very important to your overall health, but very often overlooked. We cannot avoid addressing these lifestyle pillars and the importance that they play in your health and your wellness. All of these together, taking this holistic approach, is far more effective at increasing not only your longevity, the years of your life, but the quality of your life as well. So let's look at a common scenario. Chronic fatigue. Many people are suffering from chronic fatigue today, seeking out help, and it's often very, very overlooked in conventional medicine. So in conventional medicine, the person with chronic fatigue goes to see their primary care provider. A blood test comes back, it's normal. The patient's told it's stress, and maybe they're offered some antidepressants. The integrative route, which is the partnership between the provider and you, the way that we approach things in our practice, we do a deep dive, advanced thyroid testing, check for nutrient deficiencies like vitamin B12 or iron, look at hidden infections like Epstein-Barr virus, and assess for adrenal function and mitochondrial health. I mean, if you're constantly depleted of energy, why would your doctor not want to look at your mitochondrial health? The mitochondria produce your energy. They're the generators of your cells. So if you're low in energy and you're feeling tired all the time, we need to look at this entire picture. Is it hormones? Is it a nutrient deficiency? Is there something going on toxin-wise in your mitochondria that's preventing them from producing the energy that you need? The treatment plan, quote unquote, becomes a coordinated strategy. So we look at all these different areas and we address the things that need to be addressed, and we work in partnership with your provider. Targeted supplements to fuel the mitochondria, stress reduction techniques, and dietary changes to reduce inflammation. That's right. Many people we find in our practice are suffering from chronic systemic inflammation, which is draining their body of energy. If your body's constantly working to try to reduce inflammation, to heal itself from something that maybe you don't even know that you have, it will not have energy the excess energy to help you to feel like you're energetic or you're lively. So the goal is to move from managing the illness to achieving optimal health. That's a big difference between integrative functional medicine and conventional medicine, is that we don't want to just help you to hit a normal lab level or to get rid of a symptom. We want to help you to optimize, get to optimal level so that your body isn't constantly working so hard to heal itself. It's about not settling for just okay, which is what a lot of people have done for years before they come and see a functional medicine practitioner, is that they settle for okay, and then they finally get tired of just being okay or not being okay at all, and they seek out some root cause approaches to getting better. So there's 3 steps to start integrating your health. Okay, you don't need to overhaul your life tomorrow, but you can start on the path to integrative wellness today with these 3 simple steps. 1, be your own health detective. That's right. Too many conventional medicine doctors actually discourage patients from educating themselves. We want you to educate yourself. Be your own detective. Start a detailed log. Note your energy levels, your mood, digestion, and sleep every day for a while. This data is invaluable. Your symptoms are clues, not just annoyances. So every symptom is your body's way of giving you a clue to what is happening and what's not okay. Number two, find the right partners. Look for practitioners who talk about root cause and are willing to collaborate. A naturopath, an integrative MD, a functional nutritionist, a functional health coach. Don't ditch your conventional doctor. Add a supportive layer of care. Choose one pillar to optimize. Again, we don't have to do it all at once. Choose one pillar to optimize. Don't try to change your diet, start meditating, and run a marathon all in 1 week. That is a sure way of setting yourself up for failure. Pick one pillar, say sleep, and commit to optimizing it for 30 days. Better sleep, for example, is the foundation for everything else. Integrative health is not a quick fix. It's a profound shift in your mindset. It's the realization that true healing is a symphony, not a solo performance. It requires a partnership between you and your care team, blending the best of science and nature while honoring the simple truth. You are a complex, interconnected whole. Don't let chronic health issues define you. Unleash your body's potential for healing. That's it for this week's Wellness Unleashed. Again, we want to thank our sponsors, Stubborn Bean Coffee Company, whom you can find at stubbornbeancoffee.com. The best coffee, get there. I recommend the Builder's Brew, their mushroom and coffee mix. It tastes fantastic. I drink it in the morning myself. And also by Doc Stone's Natural Medicine and Wellness. Order your functional lab test direct to your home without having to see your primary care physician at docstone.wellproz.com. Next time, we're going to dive into another amazing natural health and wellness topic. You don't want to miss it. You can find more resources and links to vetted integrative health organizations on our website. I'm Jeremy Doc Stone, and I'll see you next week. Thank you for watching Wellness Unleashed with Doc Stone on the AeroStream TV network. The opinions expressed by the host and guests of this show are theirs and not the opinions of the network or our sponsors. None of the information shared on today's episode should be taken as medical advice. Statements have not been approved by the FDA or any other governmental authority. And if you're experiencing any kind of illness or wellness issue, you are encouraged to consult with your licensed healthcare practitioner. And we do appreciate you watching our show and look forward to seeing you on the next episode.